morning, Mrs. Smith. My name is Kim. I'm your CNA, and I need to go ahead and clean your catheter, ma'am, if that's okay. Okay, great. Right, I'm going to go ahead and give you some privacy. Let's pull your curtain. All right. Let me just get my things set up. I just put a little towel down here on your table to keep your table nice and clean. Okay. Okay, and I'm going to come over here and put your side rail up. Okay. I'm going to go get some water and I'll be right back, ma'am. Okay, ma'am. The water felt pretty good to me, but would you please test it? Even though this is a mannequin, we always need to make sure that the evaluator sees that we are testing the water. Okay. That feels pretty good to you? Okay, ma'am, I'm going to put your bed up to a good working height for me. Okay. I think that'll be high enough. I'll be pulling back your covers, but I'm only going to try to expose just your catheter. The first I need for you, if you would please, ma'am, to roll over on your side so I can go ahead and put this pad underneath you so we don't soil your bed. Roll. Great. Okay. And if you would come back towards me, please. Wonderful. Now I'm only going to expose the area around your catheter, so I'm going to pull your gown up, ma'am. Okay? I'm going to wet a washcloth and put some soap on it. Ooh, almost lost our soap. All right, ma'am. Now you're going to feel a little bit of pressure here because I need to pinch the tubing right here at your urinary meatus. You're going to feel a little bit of pressure because we don't want to pull this catheter out. I'm going to wash at least 4 inches. Make sure it's at least 4 inches. Not 4 inches, at least 4 inches. I used one side of my cloth. Now I'm using a different side of the soapy cloth. Okay? Dispose of that one. Just set it there on the side of your basin. And now, ma'am, once again, you're going to feel some pressure as I pinch this right here at the urinary meatus. And I'm going to rinse using different part of the cloth for each swipe, at least 4 inches. The next step, while still holding on to the catheter so it does not tug out, you will dry at least 4 inches of your catheter. If you need to make another swipe, use a different part of your cloth. Okay. Now we want to go ahead, cover her, have her roll to her side, and remove the linen protector from underneath. Okay, ma'am, if you could come back over this way, please. Thank you. And remember, we are always rolling away from ourselves. Okay, dispose of the used linen protector in the trash. Ma'am, I'll be right back and get you comfortable after I pick up these used linens and dispose of them. Take your used linens and dispose of them in the appropriate hamper. that in the designated dirty. And now, please note that you must dump, rinse, and also dry the basin. If you neglect to do any of these three parts, then you will not pass that particular, particular step. I'm drying the basin out. I will now place the dirty basin in the designated dirty area. I will remove my gloves appropriately without contaminating myself. And I will verbalize, wash my hands. Now I will proceed to go back to the client and make them comfortable. Okay, ma'am, let's get you a little more comfortable. Straighten your covers. Ma'am, here's your call light. I'm going to place it right next to you, so it will be within your reach. I'm going to put your bed in the lowest position. I'll pull back your privacy curtain so you can chat with your neighbor. If there's nothing else I can do for you, ma'am, I'm going to once again verbalize and wash my hands. And that concludes catheter care.